What is forensic nursing and how to become a forensic nurse? Forensic nursing might be for you if you have deep empathy with the victims of abuse and feel strongly that justice needs to be done. Violence is an ever-present social and health problem, and forensic nurses are the link between the health care system and the law. What is forensic nursing? Forensic nursing is the application of nursing globally when health and legal arrangements meet. It is one of the most recent, but rapidly growing, specialty areas in nursing. What is a forensic nurse? Forensic nurses are registered nurses who received specialized education and training to provide care to patients who experienced victimization or violence. They are the first point of contact between the victim of crime and the health care system. And from the bodies of victims of physical injury and violence, living or dead, they collect the physical evidence required for criminal investigations. They consult, cooperate, and communicate with law enforcement agencies, and can be called on to testify in court as expert witnesses. While sexual assault nurse examiners are probably the best known within the field, forensic nurses provide services in various fields where health care and the law intersect. This includes domestic violence, child and elderly abuse, human trafficking, death investigations, and man-made and natural disasters. In an ideal situation, a forensic nurse will be the first healthcare professional to deal with a victim of violence or abuse. That includes sexual assault, domestic violence, child or elder abuse, human trafficking, assault, or homicide. He or she may also be called on to assess and collect evidence from the perpetrators of the crime. The types of evidence collected include specialized digital photographs of injuries, specimens such as blood, semen, skin, hair strands and swabs for DNA analysis, clothing, bullets and more. The nurse's psychosocial skills are critical in providing comfort, emotional support, and education to the victims and their families, especially during the interview, physical exam, and collection of evidences. Where do forensic nurses work? In the United States, most forensic nurses practice in emergency departments and sexual assault centers in which they deal with adult and child victims of rape and sexual molestation. These nurses work either alone, in a team, or being on call during all hours of the day or night. What are the qualifications of a forensic nurse? Working with the victims of trauma can be emotionally draining, and anyone who is preparing to become a forensic nurse, besides being compassionate, should be resilient and emotionally stable. Extra recommended qualities are needed for forensic nurses to qualify in this field. These include the ability to work and coordinate in a fast-paced environment. He or she must possess good communication skills, has the ability to give much attention to details, and has a good analysis and evaluation of an issue in order to form a judgment. Nurses can also obtain a master's degree in forensic nursing offered by various universities to qualify for advanced practice as forensic nurse investigators. This is usually the requirement in order for aspirants to work as a legal nurse consultant, death investigator, or nurse coroner. How much does a forensic nurse earn? The salaries offered for forensic nursing jobs in the various states in the U.S. vary widely. In a reported survey in 2016, the median salary for a forensic nurse was $39 per hour, or $81,800 per year. The bottom 10% of nurses made around $50,000 per year compared to $140,000 for the top 10%.